And we have with us lots of people, and I'm going to disappoint some of them by saying that we are not going to go through the congressionally directed spending application process today, with many apologies. Senator Merkley's staff have been, and Senator Wyden's staff have been working around the clock to get us ready for this so that we know exactly how to be successful. But Congress hasn't kept up with their ability to be on this. So we need Congress to be further along, alas, before we can go through the process of figuring out how to be effective in applying for earmarks, as it were. But with that, I would love to go around the room before we go to Director Lindsey Manfrin from Health and Human Services for the county. And if you want to introduce yourself and what organization or group or city or county you're with. I'm Casey Kula. I'm a Yamhill County Commissioner, and I'm just going to go down the list. The next person on it is, oh my gosh, is Will, but it moved on me, so Will.
Will Worthy, Interim City Manager, Newburgh, and actually a librarian.
All right, Brent.
Brent Nielsen. Can you hear me okay? So Brent Nielsen, I'm contracting with Sheridan School District on their CTE program.
Awesome. Pat.
Patrick Evans. I'm one of the two folks that are involved with Turtle Dove Shelters. We've just completed number 42, and under construction is number 43.
It goes up so much every time you join us.
Yes.
Betsy.
My name is Betsy Amity, and I am a field representative for Senator Merkley's office.
Awesome. And BJ.
Hi, folks. I'm BJ Westland. I'm Senator Merkley's Central Oregon field rep. And are we here talking about approach? I'm confused now. No, we're not doing that. I was not informed of that. Okay. Well, I'm also the approach liaison for this state. So pleasure to meet you all. If you have any questions, I'm sure we'll be talking here in the near future.
Awesome. I don't actually know what that is, but it's okay. Maybe other people do. Thanks for joining us.
Yeah.
Sorry about that, BJ.
Yeah, no worries. It's all good. All right.
But it means that you have some extra time in your day.
Yeah.
All right, City of Amity. Fritz.
No, I'm City of Amity. We're here. I'm going to defer to Mayor King, though.
Perfect. Thank you, Michael.
All right, I'm Rachel King, Mayor for the City of Amity.
All right, Fritz.
Fritz Graham in the Salem, Oregon field office for Senator Wyden and covers 7 counties, including Yamhill County.
Thank you. Heidi.
Yes, hello, City Manager, City of Sheridan. Hello, everyone.
Welcome.
Thanks for having me.
Yes, thank you for joining us. Jeff. Or as in Jeff T.
Yeah, I was going to say there's always like 2 or 3 of us on the line. Jeff Towery, I'm the city manager of the city of McMinnville. Well, to some extent, we're all interim, so welcome to the club. And I'm going to actually beg everybody's forgiveness. I was here specifically for the thing that we won't be talking about. I had to leave another meeting a little early, so I'm going to go back and rejoin the finish of that other meeting. And I think we're well represented with other members of our team. Thanks, everyone.
Absolutely. Nice to see you, Jeff Towery.
Take care.
Right, Susan.
Susan Muir, City of McMinnville, Parks and Rec, and I'm here for Lindsey, so I'm in the right spot.
Awesome. Well, along those lines, Councilor Menke.
Hello. I'm here. That's about it. Thanks.
Thank you. Luke Westfall.
You guys hear me okay? Okay, Luke Westfall. I'm the coordinator for your Greater Yamhill Watershed Councils. We're a nonprofit that does natural resources improvement in the Yamhill and Chehalem valleys.
Awesome, thank you. Michael.
Hello, everyone. Michael Langley. I'm a tribal council secretary for the Confederated Tribes of Grand Ronde.
It's good to see you this week.
Good to see you, Casey.
Mayor Watkins.
Linda Watkins, Mayor, City of Carlton.
Awesome. Thank you so much, Mayor. And I believe, let's see, we have Director Manfrin.
Everyone, Lindsey Manfrin, Yamhill County Health and Human Services Director and Public Health Administrator.
Awesome. Thank you so much. I think that I got everybody here, and I'm going to start getting in some other people. So with this, I'm going to pass it off to Director Manfrin to both provide an update on Omicron surge, testing, vaccination, and really anything else that you would like to ask her that she's willing to take a dive into that's public health related. And with that, thank you so much for joining us in your incredibly busy schedule right now.
Absolutely. Thanks for having me. As Commissioner Kula sort of started listing things off, right, there have been a lot of changes over the course of the last few days. And, we just once again find ourselves in this moment of rapid change. So I'm going to go through and talk sort of a high level about various things, and then definitely am able to answer any questions that you may have with any of those topics as well. I think I'll just start by giving a general update of where we're at with Yamhill County. So we are certainly seeing a surge of cases similar to what we're seeing around the state. Last week, we had our highest number of cases ever in a week. We had over 700 cases last week. And just for a little bit of perspective, up until last week, our highest week we'd ever had, which was last summer during that Delta wave, was around 435. So significantly higher than what we have had in the past. And over the weekend, we had around 300 cases. So we're just anticipating that we're going to continue to see this increase over the course of the next couple of weeks. Now, we are watching closely the projections made by Oregon Health and Science University, OHSU. I will say they have been pretty spot on throughout the course of the pandemic. And so what they are predicting at this point is that we will reach our peak cases on January 27th. An updated report comes out every Thursday, and so sometimes there will be changes based on what we're seeing and how things are evolving specifically in Oregon. But at this moment in time, that is when we're anticipating our peak. Currently, it's showing a pretty quick drop in cases after the peak, and we are all hopeful that that is what will happen. But I think there's going to be a little bit of wait and see to see exactly how fast we begin to decline in cases. Now, clearly, the Omicron variant is incredibly contagious, far more contagious than any of the other variants, and that's why we're seeing this rapid increase in number of cases. Now, the good news is that it really does appear that it is less severe, and so what that means is what we're seeing, at least at this point, a smaller percentage of people having severe disease, including people needing hospital care. Additionally, those that are needing hospital care, we are seeing less need for things like intensive care stays and less need for ventilation. We don't have all the answers to why. It could be truly that the variant really is just different. And we are also in a state where we have far more people vaccinated and even getting more and more boosters. And so obviously that impacts the severity and those types of things. We are seeing an increase in breakthrough cases, although still the majority of cases are in unvaccinated individuals, where we were seeing previously, 25-ish to 30% of cases be breakthrough cases. That's up to about 40 cases. So we're kind of at the 60-40 based on the local data from last week, which is fairly close to what the state is looking at right now as well. What we are seeing, though, is those that are vaccinated, particularly those who have had a booster vaccine, are certainly experiencing, there's far less hospitalization and severe COVID. So we know that the vaccines, while yes, there is, they are less protective against getting any COVID illness, they continue to be protective around the severe cases. Again, the boosters really do impact that. One thing that I do want to make sure I mention is the changes in isolation and quarantine. So those came out last week. There are some specific guidelines for healthcare providers. There are some specific things to schools. I'm not going to talk necessarily about either of those things, although I'm happy to answer questions if there are. But with the general population, the quarantine and isolation periods now match, and both of them are 5 days. Now, one thing that I do really want to emphasize is that for someone who's isolating 5 days because they have symptoms, in order to come out of that isolation period In addition to the 5 days, there's 2 other criteria that need to be met. One is that the individual needs to be fever-free for at least 24 hours, and their other symptoms like cough or shortness of breath need to be improving. They don't need to be completely gone, but they need to be improving. And so all 3 of those criteria need to be met for someone who is either symptomatic or has been diagnosed with COVID for them to no longer need to isolate. Then of course, for the remaining 5 days, or perhaps less if say someone had a fever for longer, but for that remaining period of time, they need to make sure that they are masking and using a well-fitted mask that's going to help keep the folks around them safe. With quarantine, and again, quarantine is what happens when someone is exposed but not sick. For those individuals that need to quarantine, that quarantine period is 5 days from the time the person had their last exposure. And that's when the clock would tick, and then they'd be able to come out of that quarantine, assuming that they didn't test positive or that they didn't begin getting symptoms after that 5-day quarantine on day 6. That leads me to testing, right? Anyone who's tried to get a test recently knows the testing capacity is quite limited. And I wish that I had better news to share, but what I can share is it's not going to get better over the course of the next couple of weeks. Public health has mounted as big of a response as we possibly can to ensure that people are able to access testing, but we know that it's not enough. And at this point in time, we just don't have other resource to be able to put to it. Largely the resource we're missing is staff, is people who are able to be there and administer the tests or be part of the testing process, whether that's traffic control or other types of positions that we have when we're doing those events. There is still testing that's available a couple, like Tuesdays and Thursdays through the fairgrounds. We are doing rapid tests and the PCRs, or the send out tests. Both are available. And then there's a couple of other options for some testing that you can visit our website for in terms of some scheduled locations and things like that. So certainly check out our website if that's something that you're needing or looking for. Because testing is so limited at this time, it really is my recommendation that individuals who are having COVID symptoms assume that they have COVID. The recommendation is to get tested, and if you can get tested, that's fantastic. And if not, just assume that your symptoms are COVID and do that 5-day isolation period and watch your symptoms for fever and those types of things. I think that's unfortunately sort of the best we're going to get over the course of the next few weeks, when we can just anticipate that demand for testing is going to increase, and yet the supply, whether or the capacity, whether again it's the supply of the tests themselves or the staffing is not anticipated to grow. Many of you have heard about the tests that are coming from the Oregon Health Authority to local public health authorities to administer, or to really distribute, I should say, to community. I will say that there's a couple of parameters around how those tests can and should be used. One of them being to really focus on getting those tests to populations of people who have been disproportionately impacted by COVID, as well as for things for people who have been exposed and needing to work and things like that. What they are not intended to be used for is screening or things around just, and there are people, they're just wanting to double check, right? Things like that. And again, in a perfect world, that would be great and fine, but in this resource constrained environment, that's just not possible. We have a community group that is put together of various community partners who have really helped us develop and implement our vaccine equity plan. So making sure that we're reaching people for vaccine who may struggle to get vaccine or be, again, disproportionately impacted by COVID. We're using that same group and we are meeting today to talk about our plan and how we will equitably distribute these these tests that we're getting from the Oregon Health Authority. It seems like a lot of tests, but really what we're getting is a roughly 15,000 kits. Each kit comes with 2 tests, but the tests and the kits can't be separated. So really we're looking at having about 15,000 to distribute to a community of 109,000 people, and most of them wanting a test, or at least it feels that way. So we are going to be working with that group to prioritize where those tests are going. Again, with a focus on those people who have been most significantly impacted and those people who we anticipate struggling the most to find testing or requiring tests. We hope to have more information about what that plan will look like by the end of the weekend. We'll certainly share it with the community at large as we have that more and more developed. We don't have a time frame on when we're getting those tests. We are hoping that we will get some potentially even late this week or next week. And we don't believe that we'll be able to get all 15,000 at the same time. We think that it'll be sort of a rolling week over week. And so we don't know exactly how many are coming. Our plan is to develop a plan based on those 15,000 with priorities within that, so that we know when we get our first shipment, these are the top priorities and these are where we are going. Prior to OHA making the announcement that they are getting these tests and will be distributing these tests, local public health, we actually purchased around 12,000 kits or 2,400 tests before we knew OHA was going to be doing that. Those tests have started to arrive. I believe we got the first shipment late last week. Again, we're not getting them all at once, we're getting them incrementally. And those tests that we purchased, we've been really focused on getting them to some community partners that we know work closely with, our Latinx community who have been very impacted by COVID, and our homeless shelters, where especially when we have our warming shelters that are opening up and we have people congregating together and needing that space, getting it to those. So that's the first group of people that we have prioritized, and that's where those tests have gone so far. Again, we are working through and with that community group to really make sure that we are looking at all of the county and taking things into account around geography and just everything that we possibly can when we're talking about those remaining tests that we're yet to get, either because they're the ones that we purchased ourselves or the ones that we're going to be getting from or the Oregon Health Authority. There's a couple of other things. There's just a lot going on. So I wanted to make sure that folks understood that one of the changes that has happened with, again, related to quarantine and isolation is historically individuals who are considered, the term fully vaccinated have not needed to quarantine as long as they remain asymptomatic. That is still true. However, the definition of that has changed. And what that means is for those who are 18 and over, they are required to have a booster vaccine in order to not have to quarantine. So that is a shift. So individuals who have had the 2 doses of one of the mRNA vaccines or a single dose of Johnson & Johnson, if they have gone past the time period where they would be eligible for a booster and have not gotten a booster, they would not be considered they would not be considered up to date, and they would need to quarantine. So you either have to have had the booster or still be within that window where you're not eligible for a booster yet. So that's a pretty significant change. I wanted to make sure we got that information out. One last change that is quite significant and may or may not come as a surprise, because I know there's been other counties that have been making similar giving similar messages to communities. And OHA, if you watch the press conference, talked a little bit about this on Friday, which is beginning tomorrow, Wednesday the 12th, Yamhill County Public Health will no longer be doing active case investigation or contact tracing to positive cases. This is for a number of reasons. One is the capacity is just not there. When we are getting the number of cases that we are getting these days, that is just not something that is able to be attainable. And from a public health tools standpoint, once we get to this amount of spread and we have something as contagious as this variant is, those tools are no longer effective like they have been historically or like they are with other diseases, because these are tools public health has used for a long time, even before COVID. And so that certainly has impact on what we would like to see from you as community members. And it also has some pretty significant impacts from an employer standpoint. And so we're going to be working on getting some FAQs and things like that specifically for employers to help guide them through some of the ways that this might impact them. But I think the general message is you shouldn't wait for a call. If you test positive or if you have symptoms, again, assume it's COVID, and we want you to be notifying the folks that you've been around that might have been exposed, so that they can take any necessary steps to protect themselves or the people that they might be around. What this means is, for people that may be looking for some sort of documentation of these things. I think there's going to be some of that folks can still find and some of it they can't. So, I would encourage employers that are needing test results to just take the test results themselves and not necessarily a letter from public health, right? So if someone has had a test, they should get a positive or a negative result if it's one that went to the lab. If someone gets a rapid test through public health in one of our events, they will get a documented letter or a piece of paper that says that they had a positive or negative test. But then there's a whole slew of people who are testing at home, right? These at-home tests, or the people that may not be able to get a test but have symptoms or have been exposed. And those are all the things that people and employers are going to need to be thinking through. How will they manage that within their systems, within their HR departments, if you will? One thing we will continue to do though is provide support, particularly to places like long-term care facilities, schools, or anywhere else where there's an outbreak that's happening, where there's something that feels unusual or where there's technical assistance needed from public health. We're still going to be doing that and still want people to call us when those things are happening. But what won't be happening again is those individual calls to every case when we get a lab report that comes to us. So that is a lot of information that I shared around a lot of things that have changed very quickly. So I'm going to pause and I'm going to see if there are any questions about any of those things.
And this is even without talking about vaccination clinics and boosters. Well, first of all, feel free to raise your hand, either your digital hand or your real hand. If you have questions or comments, concerns, how do we do this for Director Manfrin? But I'm happy to take a moment because it is a lot of information. And we'll start with Abhisha. And for the folks in the audience, the attendees section, you also can raise your digital hand and I can allow you to talk. But go ahead, Abhisha.
Thank you, Commissioner, and thank you, Dr. Manfrin, for just kind of all of that information. It's a lot, but there's so much going on. Excuse me. For the sake of our industry and business partners, when you talk about available testing for folks that are trying to get back to work, can you elaborate on that a little bit more so I'm sure to inform people correctly about the resource that might be available?
Absolutely. So I think depending on how fast and where we end up prioritizing those rapid tests, right, I think that there's going to be certain types of businesses or organizations that may get some of those tests. Although, like I said, 15,000 kits sounds like a lot at first, but it's going to go quickly. So I don't think that that's what employers should be counting on in terms of their planning. But what I do think that employers need to be thinking about and considering is what are my policies going to be when I have an employee who's out sick and can't get tested? What am I going to tell them? For some employers, this is how they've been accessing, COVID leave or different types of benefits. And so all of those things are going to I would encourage them to rethink how they're using that or defining that. Some of the questions I've been getting from employers is, should I have employees send me a picture of their rapid test if it's positive or negative, right? Depending on what they're doing. Some employer might require the positive test for X, Y, or Z. Some might require a negative test for X, Y, or Z. And my answer is certainly every employer is going to need to make these decisions based on what is going to be best for them. And really thinking through, how much of an administrative burdensome system do you want to put in place for something that may or may not really have a real impact? Because I hear from employers there might be concerns about employees maybe trying to get leave that don't qualify for it, and just I think that we're going to need to live in this space of for a couple of weeks where there's going to have to be some calculated risks that employers take on how far they lean into that or not. And, again, I can't tell other employers what to do. I can just share that this is the context that they have to make these decisions on. You're going to have staff that are going to be sick or exposed, and they're not going to have a letter from public health saying that they're a contact and need to quarantine. They're going to have a phone call from their friend that they just had dinner with, right? Or they're going to have maybe a at-home test, and employers are saying, should I have them send it to me or not? Again, that's up to you. How much of a system do you want to build for a test that could be a picture that came from anywhere? Or if you have sick employees and they can't get tested, my recommendation is to assume it's COVID and have them follow the isolation guidelines, even if they can't get tested, because we just know, especially with the amount of the challenge with getting tested, you're going to eat up a lot of that isolation time anyways, even before you get to maybe the results of your test. So hopefully that helped. Yeah.
It is. Thank you.
Other questions for Director Manfrin? Director Manfrin, so last week at Commissioner meeting, you were kind enough to answer lots and lots of questions. And one of the things you said in that was that people continue to at least get a phone call that says, hey, here's what to do when you are sick or when you've gotten that positive result. But that's different than a contact tracing investigation. Are you still doing that at all, or is it no more phone calls?
At this point
or
in time,
is it something in between?
Or something in between. At this point in time, there's no active phone calls happening from us. So, but what we are doing is trying to work with places that might be in contact with higher risk populations and finding as many ways as we possibly can to get people access to the information that they need, whether that information is what to do from an isolation and quarantine standpoint, what to do from what are the signs and symptoms that I should reach out to a healthcare provider from, right? And we need to do that balance because we can't give specific individual healthcare guidance to individuals, but we can say these are the warning signs, these are the things you need to do. We can, provide some general recommendations. And then the third piece that we want to make sure people are aware of is the supports that we can provide from a wraparound standpoint, which I will say sometimes come from public health and sometimes come from our community partners, these community-based organizations that are contracted directly with OHA to provide things like food delivery for someone who may not have access to food during that isolation period of time when they just literally need food delivered. And so what we're working on right now is our communication plan on everywhere that we can go to make sure that this information is getting to as many people as possible, since we won't be able to make those individualized calls anymore. And I will say we will be issuing a press release today. And when that goes out, we will also send it to, we have a pretty broad email distribution list. We will send it there too. And that will have some links on our website to some of the things that I just mentioned around supports for people as well.
Awesome, thank you. Any other questions or comments? Mayor King.
Thank you. So to jump off that question, if we know of or find a community member, someone is sick and they don't have access to a primary care, what resources are out there, either through public health or elsewhere, or where should they go? The messaging is, don't go to the emergency room for a test, but maybe it's not life or death, but you need access to healthcare because you're ill. What would the recommendation be?
Yeah, so I guess it would depend on how ill, right? The vast majority of people are able to manage COVID symptoms at home, and we have a link to our website with some information around that, around just some things that you can do, as well as signs to watch for. I think that if someone is really in need of medical care and they don't have access to another place, I don't think there is anywhere other than the emergency department. But again, we want people to be very mindful about not using that unless they need to. If someone is struggling to act, if someone is diagnosed with COVID and they are someone that is, immune compromised or someone else that's at high risk, they can contact public health and we will work to see if we can find access to healthcare for them if they're looking for potential for getting things like monoclonal antibodies and things like that. So again, they're not necessarily exhibiting signs right now of being really sick, but they're in that really high risk category. They can call us and we can do that. With that said, all of those things like monoclonal antibodies are very limited in terms of capacity. And so the places that are seeing individuals for those types of treatments are limiting it to the highest risk of the highest risk, unfortunately, because the quantities are so limited. Certainly, if someone is in need of any of those wrap supports, whether it's food delivery or medication delivery or whatever it is in that sort of realm, then certainly they can call public health, and we will either manage that directly, or make sure that they are directly connected with one of our community-based organizations that provides that service as well. And we have a handful, which and they're doing a tremendous job throughout the county. So I think those would be the resources that I would sort of offer in terms of options for people to call and do that. OHSU, or excuse me, not OHSU, OHA is also beginning a hotline that should go live tomorrow, which will do a lot of the same things that I just mentioned that we can do locally. And we'll certainly make sure that we're pushing that information out through all of our normal means, and in hopes of folks like you and others who see it can help make sure that people who may not have access to websites, social media, those types of things, that they know how to call and get that information as well.
Thank you. And then another question for clarification. So the definition of fully vaccinated changed, you said, for those over 18. So what about the 12 to 17 age group at this point?
Yeah, it's a great question. So those individuals, those youth are eligible for a vaccine booster. Certainly, it's recommended. But as far as quarantine purposes, the 2-dose mRNA vaccine that they're eligible for is sufficient for the quarantine purposes. So they are not required to have the booster, even though they're eligible when we're talking about quarantine and isolation.
Okay, and then I think my last question, and it has to do with that. I don't know if you can speak to it, but the Ready School Safe Learners was updated January 5th, and it currently does not align with what Yamhill County Public Health or OHA has changed the isolation and quarantine guidance to. So with the news that public health needs to step back from contact tracing, where does that leave schools, and what should parents be doing? Because we know there's going to be spread in those atmospheres, and there's just so much different information coming in that it feels like it's hard to get direction to do the right thing, and maybe even some people don't know where they should be listening.
Yeah, absolutely. It is incredibly confusing. Even as I sit here talking, I'm like double checking to make sure nothing's changed in between when I started a sentence and when I ended one, and all these things. So it is for sure confusing. It's confusing to all of us. I can only imagine the folks that aren't engrossed in it every single day, like I am. So ODE did make a press release yesterday around some of these things. I think just to preempt some of those things, and then they will be updating the RSSL guidelines to follow suit if they haven't already. So it does align with the new OHA and local public health process and measures. In terms of how we will continue to work with our schools. We have amazing school districts, which I know I don't have to tell you all know that. And we've got great partnerships with them and lots of communication pathways and ways that we're able to connect. So we definitely will continue to work with our schools. I will say that they have already taken on a tremendous amount of sort of internal contact tracing, right? They've been doing that this entire year. So in some ways, this will be a shift for them, and in many ways, it won't be a shift for them. And either way, we are here for them. We, myself and our public health manager and nursing supervisor meet every other week. We'll probably meet weekly for the time being with our superintendents and some of the staff that they bring to those meetings, just so that we can, manage any questions or talk about changes and things like that. So we'll definitely continue that communication as well. But hopefully the information on the ODE website will now match the OHA information as well.
Thank you, Mayor King, for some very good questions. I have one more question for you, or at least one more at the moment, which is we hear about the EUA authorized, the emergency use authorized antivirals that seem to be effective. But I also understand that there's a limited supply. Do you anticipate them coming to public health? Are they going to go to hospitals? Do you have any more clarity around that?
Yes, as of late yesterday evening, I got a little more clarity around that. So we do not currently have any locations in Yamhill County who are poised to receive some of those antivirals at this moment in time. There's a handful of places throughout the state that are largely they're focused on federally qualified health centers and utilization of them for a number of reasons, including those organizations serve people who often have challenging access to medications and are serving the population of people, at least in Yamhill County, that have been most severely impacted by COVID. So that makes sense. In some of those places where there's not a federally qualified health center, there are, I believe, 5 emergency departments that are doing that. Again, those are in pretty remote areas of our state because it's really been determined that that's essentially where folks are getting care because they don't have as many healthcare providers and they don't have a federally qualified health center. I am working with OHA and our community partners locally to see if there is an organization that would be willing and able to take that on in terms of being able to distribute that. It is a fairly big ask just because of the type of medication that it is and some of the challenges around needing to have an on-site pharmacy. And there's just some different qualifications that make it so that it's not as cookie cutter as getting maybe some other typical types of meds. And like you said, even if we do identify an organization that's able to do that, they're estimating that we would only get roughly 20, essentially 20 doses every 2 weeks. So again, when I come back to the prioritizing the highest risk of the highest risk, that is what would need to happen with that as well.
Okay, great. Thank you. That's super helpful. Nothing like news at every moment. The one thing I wanted to follow up then, I should ask, are there any other questions that were prompted by what Director Manfrin has shared? Okay, then I would ask, I hear a lot in the news about how high filtration masks that are properly fitted are very effective, but it doesn't seem like guidance has changed. But when I ask the OHA, they say, well, there's this and this and this. Do you have the ability to just lay out for us, what should people be doing if they're concerned, and where should they go if they can't find anything except for a disposable surgical mask? And is that enough?
Yeah. Oh, so it's a good question, right? And there's not a 100% simple answer, but I'll give it my best shot here. We know that certain masks are going to be better at filtering things either out or keeping things from getting out, right? For the wearer or the people around them. And I just want to emphasize that with very few exceptions, a mask is better than no mask, right? The only exceptions to that would be is I was at the grocery store recently and someone had a crocheted mask. That is not helpful, right? So with very limited exceptions, a mask is better than no mask. I would recommend folks get sort of upgrade if they're able to even surgical masks that we have more consistency with in terms of knowing the protection levels. And then I think, yes, I am hesitant to make a recommendation that hasn't come out, although I will say that I would recommend, if you're able to wear a KN95 mask, that I would recommend doing so. We are working on procuring both some KN95 masks and N95 masks, and if we are successful in that, we will be doing community distribution of those masks for people who are wanting to upgrade to a different level of mask. I think there are some differences between the KN95s and the general N95s. The N95s are the ones that have been tested and sort of authorized within the United States. And then you've got KN95 masks that kind of go through that process in other countries. And so that, I would say that that they're not identical, but a KN95 mask is going to be more protective than a surgical mask or a general cloth mask or something of that nature. So I think most masks are better than no masks, and it is good to consider, upgrading, if you will, to another one if you can. And we're going to be working to get some of those masks and get them out to the community if we're able to.
Okay, well, thank you. I really appreciate you taking that one on. When Director Allen told me that the official guidance was that the high filtration weren't, I was like, oh, I don't know what to say or how to talk about this all of a sudden, but I am, just wearing one. And thank you for doing that, for just kind of laying it out for us. I do recall that we had OSU Extension and emergency management helping to distribute to farm workers. Last summer, the summer before, it's blended in, but
yeah.
so we know how to do this.
Yeah, emergency management, great partners, and likely they will be the ones supporting that effort if we're able to get them. Yeah.
Okay, great. Thank you very much. Any final questions or further questions? Well, thank you, Director Manfrin, for so many things. I really appreciate it. And hopefully it's helpful to cities and Parks and Rec. But with that, I also wanted to invite Michael Langley. He is here with the tribe, and the tribal headquarters has done an amazing amount of work helping the community around COVID and vaccines. And I just wanted to open the floor to you if there's anything you want to share, thoughts, reflections, and welcome.
Well, I certainly can't add more to what was just covered. That was quite in depth, for sure. And a lot of it's kind of what we've been following anyhow. We've made it a priority to get shots in arms. And the one thing that I will say is we did do a mandate at the casino, and it works. We went from just barely over 50%, and that was after having shots available right there on site, and still not being able to get those numbers up. We end up losing, out of 1,000 employees, probably about 70 over the mandate. But as a result, we went from having anywhere from contact tracing, having 70 people out at any one time, not necessarily sick, but just quarantined, to as low as 3 for all the way up until these last holidays. And of course, now things are starting to change a little bit. But still, we're not seeing hospitalizations. We're not seeing those things. We're seeing quick turnarounds on that 5-day seems to be really holding up. So the mandate, while not necessarily popular, it's effective. And I think that can't be undersold, because a lot of people seem to forget that there's a huge cost with being hospitalized. And I know a lot of people, not necessarily here, but my friends from the Tillamook area where I lived, where just that alone is really hurting some people, just being the cost of paying for that hospitalization. So right now, we are seeing an uptick in cases around here, but again, it's the unvaccinated that bear the biggest brunt of those big issues. I'm still pushing shots, so if you're having trouble getting a shot, contact us. We've really tried to extend it to people of the community, and I'd say you all are people of our community. So that's what I would say. We do have quite a good supply of testing kits, but not sure when that next shipment's going to come in. So we're being a little more judicious with those than we were.
And well, thank you. I do recall that one of your fellow council members telling me that the tribal headquarters staff, the tribal staff that wasn't the casino, had really good results in having everybody vaccinated. So
we did. So we were quickly at 90% on the tribal government side. So we didn't really, the mandates we did there are mostly with people in the healthcare, somebody that's having direct contact, especially with our elders. But not necessarily throughout the building, because we just really didn't need to.
Well, great. Thank you. Are there questions for Michael? All right. It's nice to see you in a non-transportation setting too.
Yeah, it's nice to be here. It's nice
Awesome.
to have the available slot to be here, honestly.
Yeah, that's right. Well, welcome back. Welcome back. Given community that it's 1:49, and Director Manfrin that needs to do many other things. How about if you have something you would really like to share, raise your virtual or digital hand for the community and for the folks here on the call. I do need to call on one person though, which is Abisha Stone, because there was a question from the audience about internet access and expansion in rural Yamhill County. So Abisha, are you able to update people on that?
Thank you, Commissioner. I can offer a couple of quick updates on that. So the first one is in regards to the rural broadband expansion project that was funded, seems like forever ago now, in about 2020. And that is the, what's the word I'm looking for? Online Northwest. Sorry, I wasn't ready to be called on. So that was the Online Northwest project, utilizing some of the COVID relief funding. And of course, it was prioritized that we looked at expanding broadband and also increasing childcare accessibility. And so the county funded a portion of that project, which was a very large project by Online Northwest. At last update, they had 3 towers online and 2 more that were coming online in short term. The end of that project is supposed to be, I believe, by June 30th of this year. Commissioner Kula, looking to you if you can recall as well. And at that point, we should have a more comprehensive update on the impacts of that particular project. The next update is just the county's approach to continuing to improve upon broadband expansion and accessibility, which could also have a cost component for local residents. It was determined that the county would spend, and this was by the Board of Commissioners, allocated funds into a broadband sort of bucket of funding, right? So what would that look like going forward? They also received some funding from the state in order to expand rural broadband in Yamhill County. The county put out an RFP several months back at this point and received quite a few, I would say, solid responses from service providers that were looking to do additional work in Yamhill County and not just, like I said, expand accessibility, but also increase affordability. Those funds have not yet been expended. The county is currently looking for a third-party service provider to help execute that grant program. It's my understanding that there's still a great desire and expectation to get these funds out as quickly as possible, but certainly there's a lot of pause points related to that. One of them being that the feds just released the final interim rules for use of those funds on the 7th, right? So there's a good reason to be patient with rolling out some of these programs so that we can ensure that all of the programs are managed appropriately. And at the same time, we know that our community and business partners are very eager for that funding to be made available. So those are the updates I currently have.
I think that was pretty good. Are there any other updates you'd like to share with folks here today?
No. Thank you. I'm looking at the time and I probably took plenty. Thank you though.
Okay, great. Thank you. Any other city community organizations would like to do an update? And really, like, you have time. So for example, Mayor King, I'd love to hear from you.
Thank you. Really quickly, I just want to get the information out there that myself and City Council will be hosting a town hall this coming Wednesday, the 19th at 6 o'clock. I'll do a brief overview of our state of the city and hit on some highlights of the goals we were able to accomplish from the last year. But really, it's just an opportunity for community to come in with questions, concerns, ideas, and myself and the council, and something outside of the formal council meeting sessions. So I'm really hoping we're going to open up to a big area. There's room. There will be a Zoom link. It's currently online and on the Facebook page, so you can, if you don't feel comfortable coming in person. And I just want to throw an open invite there to all that we'd love to see you.
Awesome. Thank you very much. Mayor Watkins, you turn on your camera. Would you like to share with people today?
Actually, I just turned it on so I could say hi, but no, I have nothing really important to share. So I was enjoying Mayor King's description of what they're doing over in Amity. And I think I'm going to talk to Shannon about stealing that idea from you guys. So thanks.
Good idea. And I will note that unless there are other folks, I'm happy to give you a quick update, is that we have in the agenda this week for the Board of Commissioners approval of the water and sewer infrastructure grants. So thanks to possibly a person who's here with us today, but he's not smiling yet, so maybe Pat didn't. So thank you to the grant evaluators who looked at all these applications and took a real deep dive into them to decide what was best to move forward. So stay tuned for that. We'll have the conversation. It's in the agenda packet, but I don't want to tell you your community is getting a chunk of money before we've actually decided that, but it is in the agenda. So that's very exciting. We'll be talking about the next steps for broadband. And we're moving forward with a couple of other areas of the American Rescue Plan funding. So stay tuned. But with that, remember that Director Manfrin was like, get boosted, right? Because boosting increases your chances of not going to the hospital. Wear apparently a good mask, and the better, the better. And then stay away from other people if you can, and make sure you get tested if you're experiencing symptoms. So with that, unless there are any final thoughts, I'll say thank you very much to everybody who's joined us today, and to the people in the community. We will get through this, and it's going fast. It's going to be really hard for a couple of weeks here. And my hearts go out to all of you, because I know that a lot of people are really challenged right now by all of the closures, updates, staying home from work, holding kids back from school. We will get through this. So thank you very much.